Hello, everyone, and welcome to our monthly Digital BC live stream. For those of you who have come back, thank you for coming back. For those of you who are new, we try to pick relevant topics to our digital community and go a bit deeper on them every month and see what comes up next. So I'm excited about today's session. We have Ray and Gislene joining us to talk about gender and sex data standards. Something you may have heard about or you may not have, but we're gonna give that to you today so that you have a bit more understanding. My name is Jillian Carruthers. I'm the Senior Executive Director of Digital Identity and Trust in the Ministry of Citizen Services. I use the pronouns she and her. And today, for those of you who may not be able to see me, I am wearing a white shirt, which I am terrified to get coffee on. It is very bright white. So I will not be drinking coffee today. I have short shoulder length hair. I have a little bit of gray that's filtering through there. I call them my highlights, blue eyes, and I talk a little bit with a smile on a regular basis here. So you get to see some teeth if you like it or not. Things I kind of enjoy about myself. I do want to start very importantly here with the fact that I'm joining you from the beautiful Victoria, British Columbia, as is Ray and Gislene. These are the traditional territories of the Lekwungen peoples, Songhees and Esquimalt nations, whose traditional relationship continues with the land today. And I'm incredibly grateful to spend my time here, to work, to live, to play, to raise my family here every day. And I would encourage you, if you're not joining from Victoria or even the Victoria area broadly, if you're on different traditional territories, just take a moment to acknowledge those territories that you're joining us from. Okay, a couple of housekeeping things, then we get into the good stuff. So first off, you'll see that this is being recorded. This is going to be published internal and externally, so you will see that pop up. If you're joining us on MS Teams Live today, you can access captions by using those three dots. Pull down and double check captions there if you need those or you'd like those. If you're doing it on YouTube, you know where to find them, that CC button. There will, of course, be a podcast later. So this is one of the key pieces, especially on this topic where there's a lot of stuff we can dig into. There will be a podcast that will follow up. So it's really important that if you have a question, put it in, because we might not get to it today, but we will find time to get to that question. And it's worth the conversation. Last, there's a survey. There's always a survey to these things. So when the survey comes out, please fill it out, because we want to talk about the things that are important to you in the coming months. And the only way we can do that is if you actually tell us what's important to you. So please fill out that survey that you get. Okay, Ray, Gislene, thank you for bearing with me for that opening and joining us today. Let's start with a quick intro. Gislene, to you.
And thanks very much, Jill. So I am Gislene Guenard. I am a director with BC Data Service. And to describe myself a bit, I have chin-length red hair. I'm wearing a black blouse with little red and white flowers and red earrings. My pronouns are she and her.
Thanks. I'm Ray Larson, and I'm from the Social Sector Information Services Division. I use he and him pronouns, and to describe myself a little bit, I have a fair complexion and brown eyes and short dark blonde hair, and I'm wearing blue glasses. I have a floral shirt with a burgundy sweater vest, and also, like Jill, I often smile when I am speaking. And grateful, both of us, to be coming to you today from the Lekwungen speaking territory.
Absolutely. Thanks, Ray.
Amazing. Thank you. Well, so today, we're talking about the gender and sex data standard. So this is something that is a really, really important tool for us to support inclusion and make sure that we have a culturally safe and welcoming environment when we're providing service, government broadly, when we're providing services to residents or citizens or British Columbians or even beyond that. We're going to hear a little bit about the social sector, Ray and Gislene, talk about how ministries have adopted these standards, maybe a bit of the history of where this came from and how we got here. So maybe we'll just start with the very beginning here, which is, why do we need a standard for gender and sex data?
Absolutely, Jill. That's a great place to start. We really need the standard because accurate data really has the power to enable better decision making and to make change happen. Behind every piece of data is a human story, is a human being. Take something as simple as a piece of data about your gender or your sex. Does that seem like a simple or easy question to answer? Is it easy or does it raise some anxiety? What are the impacts if this data is not accurate? Or of even just answering this question and not feeling safe to answer it? The truth is that gender and sex have often been confused or used interchangeably in government data collection. By adopting this standard, the data quality improves and so will service delivery. And most importantly, when individuals are able to self-identify their gender, the province is able to engage with them in an inclusive, safe, and respectful way.
So I really like how this is framed. This is a tool that we can use. We can use this to be better at what we do as an organization, and we have a responsibility to do that. So how did this begin? How did it start?
Well, really, it all started, and there'll just be a slide that's presented here so you can see. It started back in 2016 with changes to the BC Human Rights Code. It was amended to include gender identity and expression as protected grounds covered by the code. There was also a push from advanced education and BC University students who were looking for options beyond the binary of male and female when they were submitting applications to post-secondary education. They were saying that the current options didn't represent them, didn't represent everyone. It wasn't inclusive. The work in government then began as a collaboration with our business sponsor, so the Gender Equity Office with the Ministry of Finance, and their focus was really on creating equity, opportunities for people living in BC regardless of their gender. Now, they partnered with us in BC Data Service with the Ministry of Citizen Services, where our focus is really on developing data solutions to help government better serve the people of BC. It was that partnership together with many others that developed the gender and sex data standard. So there were multiple ministries, at least 13. PSA was involved, ICBC was involved. And we also had multiple consultations and conversations with organizations like TransCare, with experts in ethics and legal advisors. We also, as you can imagine, over time, multiple drafts, tons of discussion, and lots of learning for all of us along the way.
Excellent. And you kind of mentioned the pathway to get here, but how specifically do you intend this standard to support inclusion and kind of help use, so we can use that as that tool to support inclusion going forward?
Absolutely, that really is our primary reason. Really, the biggest thing first is that it recognizes that gender and sex data are two different things. They're not the same. As mentioned previously, historically, we have confused or conflated the two. So really, in order to clearly identify that there are two separate concepts, we need definitions to really clearly identify what these mean so that we can better understand when it's appropriate to use the term sex versus gender. And then thirdly, really by including more options beyond the binary of male-female. And that is something historically we've only been using. So in different ways, we collect sex data or we collect gender data. We call it male-female. There are no other options. And really with the definition, getting clarity that sex is something that's assigned at birth. And it's most often based on physical attributes, as opposed to gender, which is how a person identifies as being a man, a boy, a girl, a woman, a blend of both, or neither. Gender does involve a personal internal sense of self. One important note is that the standard emphasizes that gender or sex data should only be collected when necessary for program and service delivery. This really helps ensure that gender and sex information is used appropriately and collected in a respectful way that reduces harm. Also, when determined if it's necessary to collect this information, that the default should be to gender information as opposed to sex. The exception is for health agencies, whereas where there is a need to collect biology, and there is a separate data standard actually that Ministry of Health has been collecting or documenting as well. So by making sure that the information is consistent, we can also make sure that no one is being overlooked or left out of the picture. It's really important when analyzing data for policy development and improving services. Our population is diverse and our services need to be inclusive. of more than 30 million Canadians, for example, 15 and older, over 100,000 of us identified as transgender or non-binary. And when we take a look at BC, there's over 18,000 people reported their gender as non-binary or transgender. This is the second highest population in all of Canada. If we aren't collecting the data or allowing for the option of selecting this, it simply becomes something that's invisible that we don't know about. And so also what we believe to be true, and we'll see this as it unfolds, but that as it does become safer to self-identify, it's possible that the numbers that I just reported out are actually going to increase.
Absolutely. You hit on a couple of things for me just around, good data practices. Don't collect it if you don't need it. And I think all of us can sit and think about an application, a thing, anything that we've built in government where we collected information or data that we didn't necessarily need. So I think that's a good reminder for all of us in particular. And I just want to underscore that point that absolutely as it becomes safer for people to engage in that conversation that we may see those numbers shift. So great insights there. Okay, Ray, you've been so quiet, patiently waiting here. Your ministry and your sector in particular across education and childcare, children and family, social development, poverty reduction, those sort of broader spaces, you were the first to align with the standard and to really drive a lot of the development. So even while you were going through the development, so what motivated you and your area in particular to do that, take on that work?
Yeah, thanks, Jill. It's a great question. First, we had really strong executive support for this to align with the standard and make these options available. But our primary motivation really was to make people feel safe when interacting with our ministries, our staff, and our services. And you'll see on the slide here, our vision really was to remove gender barriers to our social sector services by enabling our systems, our people, and our processes to support a more diverse expression of gender. So really digging into that user story and supporting people. Ultimately, though, GBA Plus Phase 1 is what we called it, was about making our programs and services safer, dignified, and more welcoming for everyone, regardless of their gender. But it also, to the point Gislene's been bringing up, is about quality of information to support better services. It's about our service designers, our program evaluators, our decision makers having access to accurate and comparable information over time that empowers them to learn from the data and improve our services so they're more responsive, safe, and they meet the needs of the people we serve. Good quality information helps us understand our most vulnerable populations and how best to support them.
I love that. And I mean, I think even just hearing you talk about it, the layers of complexity start percolating in my brain. I start getting a little scared. Tell me a little bit about the approach. How did you get to adoption? How did you kind of, complexity, impact, lessons learned? What are the next steps? Give us a bit of the overview.
Sounds good. Complex, yes. You'll see on this slide just the sheer number of people and agencies that were involved. It was both technically and logistically complex, which meant massive change management. What made it so complex was due to the sheer number of people and systems involved. 3 social sector ministries, they were 2 at the time, with 1 in transition, with thousands of employees, integrated partners like health and the federal government, insurance providers, contracted agencies, all came together to make this happen. And it took an incredibly strong, dedicated group of folks on the front lines, policy, communications, human resources, our vendor partners, our partner agencies, to all come together to challenge each other and ask really tough questions and make sure we were successful. I think on the next slide really kind of lays out just how complex our systems were. So I know that there'll be people like looking at the complexity of the gender flow in our social sector systems. And I'd like to say, Jill, we should probably have a quiz afterwards, make sure that folks are paying attention. No,
that's right.
But
that's
really,
my favorite slide, Ray, as you know.
So we had 21 integrated systems like publicly facing websites and portals that our British Columbians interact with, our case management systems, and a plethora of forms that all had to get changed at the same time. So many of our social sector systems speak to each other and share gender information for the provisioning of services like medical services plan and extended health and federal benefits. So beyond the people change and the technological change, the technological complexity, was that all the gender classification information among the related systems all needed to be updated at the same time. And if I'm going to be really honest, it wasn't all rosy and it was tricky. In some cases during discovery, we missed some things like forms that had logic that changed pronouns based on gender. And also, whilst the Ministry of Health, our insurance providers, the federal government were totally supportive of adopting the standard, they were totally on board, they were not quite ready and had their own timelines to align to the standard. And as you can imagine, timing for them and planning was absolutely critical, as their downstream impacts were also critical systems like health authorities and hospitals and medical clinics and doctors' offices, pharmacies, all needed to be ready to adopt the standard at the same time. So I'm sure folks who are in the IT industry or in policy understand we were faced with designing solutions one-sided in some cases. So we worked with our partners on data integration, mitigation processes and strategies. And in one case, one of our partners was able to accelerate their timelines and get some enhancements into their systems to better support our integrations, which was incredibly helpful. And the collaboration was incredible, it was awesome. Ministry staff and our partner agencies were really dedicated to getting to the best solutions. So they held us to account, they asked really challenging questions and pushed to ensure that our solid design and testing were robust, that we had really well planned mitigations in place to deal with any data integration errors. You don't want to be losing your MSP. This ultimately ensured that our clients don't experience delays or interruption to their critical services like MSP or extended health coverage. So really lessons learned for us: involve your partners early in pre-discovery and co-create solutions together, and ensure you have really robust change management in place and training and supports, and really dig into those requirements and integrations early.
That's great, thanks. Ray, there's that underscore that point of how committed people really were to get this done is just, it's incredible when we get that momentum together and can drive forward in that way, and so many partners involved too. Super cool work. Okay, get to some examples, and I see folks, by the way, questions are flowing in. Keep flowing questions in. We're going to switch questions in just a couple minutes here and answer a couple of those, but Ray, give us some examples. How did this impact your program? Where are you now, so people have something real to put in their brains? Yeah,
I think the reason or why we took this work on with such urgency and vigor was the real human impact. It's what drove us across the sector and across our partners to get it done. And it really started with our vision of removing barriers. But the bottom line is that non-binary clients who have X on their, or non-binary on their services card, on their driver's license, on their passport or birth certificate, are now able to express that when they interact with our ministries. In the case of childcare, they no longer even collect gender information, as they don't require it for service delivery. And I think that's sort of the North Star. This is why is this important? Well, through years of research, we know that transgender folks and gender diverse individuals experience a multitude of barriers that result in overrepresentation in our social sector systems and services. So you'll see some numbers up here on the slide, but really I want to point out just how challenging this is for really vulnerable population. 12% of Canadians, up to 12% of Canadians identify as 2 LGBTQ, but are overrepresented in our country's homelessness population of 25%. 2 LGBTQ Canadians are more than twice as likely as their non-LGBTQ counterparts to have experienced some sort of homelessness or housing insecurity in their lifetime. And 2 LGBTQ Canadians were 3 times more likely to have reported living in a shelter, on the street, or in an abandoned building. TELUS commissioned a study in 2016 and surveyed folks, and they found that half of 2 LGBTQ Canadians believed that their workplaces were not inclusive of trans people. And in 2020, TransPulse Canada survey showed that 89% of transgender respondents had some college or university education, but only made $30,000 a year or less. So transgender and gender diverse respondents reported that they believe they were denied employment due to their gender identity. In short, this change is the first step to removing barriers for a very vulnerable population.
Those are some incredibly sobering stats. They give me kind of a bit of a pause moment there, but wow. I want to pick up a question that came in. I want to pick up on that last point there, which is how will this impact the ability to address the pay inequity issues when it comes to, that are traditionally framed in terms of gender, male-female disparity? Any thoughts on that one? It's a good juicy one to start.
It is. And I think either of us could probably all start and you can fill in, Ray. I think really it starts with, again, kind of the standard is having the proper defined tool in order to support the collection of things like gender and sex identity. I think it really, if we're not collecting it accurately, if we don't create a safe space for the collection of this information, then we won't have the data that we need in order to showcase any sort of inequities and then be able to act on those with policy and program changes. Did I miss anything, Ray?
No, I think you've got it. Just about measuring the same things over time and making sure we understand who might be slipping through the cracks and adjusting our programs and services to adapt and better serve them.
It's you're reading the tea leaves here on the questions from the audience, it feels, because on that answer leading into the next, which is on one hand we hear collect information on gender only when necessary, period. But on the other hand, we know that data, to your point, also can help us inform how we design programs. It can help us understand how we're serving populations, and it can provide us with a ton of data. How do we balance that? Like, how do we make good policy program decisions with those factors kind of seeming at odds?
I know they really are, and that was one of the big learnings that we had with the development of the standard. And I know a lot of conversations with the Gender Equity Office, and really when we started, we were sort of presuming that the standard would involve both sort of administrative data to be able to use for statistical purposes as well as program area. Where we ended was really if you don't need to collect for your program area purpose, then don't collect it. Which got us thinking about, broader picture demographic data, aggregated data. How do we do this in a safe way? And we're really hoping to leverage some of the work that the Anti-Racism Data Act has been doing as well with the collection, so that we have demographic data at an aggregated, safe level that is available for these kind of bigger picture program area evaluations, but that it doesn't affect the service that people are coming to us for, and really trying to separate those two. And I don't think we have answers to that yet. I think it is going to have to be something that we're mindful about. I think first we have to create that safe space so that people are comfortable with sharing their data and in the way that they're comfortable with, which for me, as one thing that I learned, that a person's gender could change depending on who they're talking to because of their comfort levels. And I think that as well speaks to the use of demographic data and how to really be mindful. Sorry, once I get started on this topic. So this is probably something we can take away.
This is
because
good.
It's not a simple answer, right? Yeah.
Absolutely.
Yeah, and historically, there are populations that have undergone trauma and don't feel safe in providing government with information about themselves. So really that North Star of making sure that we're really clear about why we're collecting information, or also only collecting it when it actually is required and making it voluntary, to really start building that bridge between communities and government. And then there are other ways to collect information, like the anti-racism survey that will go out, or maybe our programs go out and engage the community members directly, and express why they want information, and that it's for the betterment of our services, and they want to understand the population better. So I think maybe at the point of entry, if we're not providing a service like MSP or a federal benefit, it might be beneficial to just not collect the information until you created that sense of safe space with the citizens, with British Columbians.
I think that makes good sense, Ray, and I think I'm hearing again that need to embed in our public service and in the people that are designing these policies and these programs, that understanding of exactly what this tool creates for us, so that we can make some of those informed judgments and understand a bit more about where we should go or could go, as opposed to, you know, just winging it. Not that we all wing it as dutiful public servants. Okay, good questions coming in. I have one more, and then there's tons that are coming in that are going to be great for the podcast. I can see various different themes starting to emerge, but this is a good one around an individual has surfaced the fact that they are working with a system that has a column for gender, or a column for sex, sorry, and in that they're seeing gender being added in some cases, and it's being misused. Is there, is there a compliance approach to what we're going to do? Is there something that, like, how are we going to enforce this? How are we going to encourage other areas to enforce that? Or are we?
Great question. Yeah. Are we going to fight? We're going to arm wrestle over this one?
From our perspective, in the social sector, generally, we don't have the need for, many of our programs don't have the need for biological sex. And of course, reaching out across government, I found that while it says sex on many of our documentation, like our ID, that for international reasons, what it actually means is gender. So you'll see sex on your ID, and that underlying in the data means gender. And I know that from our perspective, we're enabling our systems in the back end to have a sex assigned at birth data field available should we ever need it, to clearly differentiate between those things. I don't know that we'll ever need that, but it's probably good to make sure that that information is clear. And any data that we have right now where it says sex in our older legacy systems is to be understood that it's not biological or not sex assigned at birth. And does that seem to make sense?
It really does. It really does. And I think it's perfect that that question has come up, and I love that people are already starting to think about it, because I think that's the first step, is where are we collecting this information, and are we collecting it accurately? As far as compliance, that's a blessing and a curse when it comes to standards. They are recommended. They are best practices. We do not, we're not auditing. Would we potentially, would I just be picking up the phone and starting to call people? I'm not going to rule that out, because I do think that it's really important that we figure out, so what are the barriers? Why haven't you implemented this? We designed this to make it as adoptable, as easy as possible. And if we didn't do that, then call me, let's reach out, because then we need to maybe change the standard. But it really should be something for everyone's benefit. The citizens, the people of BC, also our ministries. I mean, we all share data, or we share, reviews of our data or how well we're doing. And we can't do that unless we're all using the same tools or the same data characteristics.
Absolutely. So many good questions are flowing in. You're going to be excited. Some teasers on, some kudos for engaging and bringing in the anti-racism components, talking about how we're going to update IM standards, what that might mean for folks, talking about how we might integrate this with our Indigenous community and some of the work that we're doing around various initiatives there. Lots of good things flowing through. So this is going to be a pretty rich podcast. We're coming up on time. I know it goes by very, very quickly, but what does this all mean for government? A couple final closing words. I don't know who wants to start, maybe Gislene.
I think what it means for us, it's good news. It means that we are looking forward to doing better with providing equitable service and safe service and being inclusive of all people that live in our province. I mean, the social sector really leading the implementation has produced a lot of lessons learned and a lot of documents to support this work. So if you're having questions, I mean, we are going to do the podcast, but I'm sure Ray and I wouldn't mind if our phones were ringing off the hook to help ministries support with this. I mean, the bottom line is we can do better, and we're stepping towards that.
I think you summed it up nicely. The big thing for me is this was just one step on our journey, and one barrier reduced, and for many people, a big one.
That's amazing, Ray. Thank you both. Great overview, great summary of the work that's happening. Clearly, a ton of work has gone into this, lots of partners, lots of commitment to getting this done and for the right reasons. So feel free. I think we're going to send some follow-up stuff. We can share those slides as well so people can engage. And then, of course, the podcast. Thank you both again. Thank you all for listening. And yeah, we'll see you all again soon.
Thanks so much.
Thank you.